For decades, autism has been largely understood through a male-centric lens, leading to a deep-rooted bias in diagnosis and research. The belief that autism is primarily a male neurotype has not only skewed scientific understanding, but also left countless autistic women and girls undiagnosed, misdiagnosed, or unsupported. The work of Gina Rapon in Off the Spectrum: Why the Science of Autism Has Failed Women and Girls highlights how systemic biases have shaped and failed the diagnosis and treatment of autism in females. A 2020 review found that boys are 10 times more likely to be referred for autism assessments than girls. Instead of receiving an autism diagnosis, up to 80% of autistic women are first diagnosed with social anxiety, eating disorders, or borderline personality disorder. These numbers reveal a diagnostic system that filters out autistic girls from an early age, often dismissing their symptoms as personality traits rather than signs of neurodivergence. Clinicians and researchers have long relied on behavioral models of autism that are based almost exclusively on male presentations of the condition, reinforcing an outdated framework that excludes autistic girls from receiving the support they need. Rapon's research further underscores this disparity. In her 2024 review of over 120 studies testing brain models of autism, nearly 70% of the studies included only male participants or had too few females to draw meaningful conclusions. Less than 10% of the 4,000 total participants in these studies were women. This lack of representation has created a vicious cycle. Since studies are largely conducted on men, diagnostic criteria reflect male behaviors, making it even harder for autistic women and girls to be recognized. The consequences of this oversight are profound. Without an accurate diagnosis, many autistic women and girls spend years struggling with social difficulties, sensory sensitivities, and overwhelming anxiety without understanding why. Some adapt by masking their autistic traits, mimicking neurotypical behavior to fit in, which can lead to severe burnout, depression, and identity confusion later in life. Despite early warnings from researchers like Lorna Wing in the 1980s, who suggested that autistic girls may be better at disguising their difficulties, mainstream diagnostic tools continued to overlook them. Bias in autism research and diagnosis does not stem from a lack of evidence, but from a refusal to shift perspectives. Confirmation bias, the tendency to seek evidence that supports pre-existing beliefs, has played a key role in this issue. Studies have shown that when teachers are presented with identical descriptions of autistic behaviors, they are more likely to identify a child as autistic if the child is named Jack rather than Chloe. This ingrained assumption that autism primarily affects boys influences decisions at every level, from classroom observations to clinical assessments. Autistic girls often exhibit different behaviors than autistic boys, which contributes to their underdiagnosis. While autistic boys are more likely to display externalizing behaviors such as hyperactivity, aggression, or repetitive physical actions, autistic girls tend to internalize their distress. They may be quiet, withdrawn, and socially anxious, traits that are easily mistaken for shyness or general introversion rather than signs of autism. This internalization leads to the phenomenon of camouflaging, where autistic girls consciously observe and mimic social behaviors to avoid standing out. This survival strategy, while effective in the short term, often leads to exhaustion, anxiety, and identity crises in adulthood. The failure to recognize autism in girls has profound consequences for mental health. Many autistic women report feelings of alienation and self-doubt, exacerbated by years of struggling to understand why they find social interactions so difficult. For those who finally receive a diagnosis in adulthood, the reaction is often a mixture of relief and grief. Relief that they finally understand themselves, and grief over years lost to misdiagnosis and misunderstanding. Many express frustration at having been labeled with anxiety disorders, personality disorders, or eating disorders when their struggles were rooted in undiagnosed autism. Despite the progress in autism awareness, systemic barriers to proper diagnosis and support persist. One of the most critical steps in addressing this issue is rethinking how autism is diagnosed. The inclusion of sensory sensitivities, such as hypersensitivity to textures, lights, and sounds, in the latest edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, TR, is a step in the right direction. However, more changes are needed to reflect the diverse ways autism manifests in girls. Education and awareness must also play a central role in changing the narrative. Teachers, parents, and healthcare professionals need to recognize that autistic girls may not fit the traditional stereotype of autism, but still require support. Schools should accommodate sensory needs, provide alternative testing environments, and foster an inclusive environment where neurodivergent students do not feel pressured to mask their true selves. Listening to autistic voices is crucial in reshaping autism research and diagnosis. The movement for participatory research, where autistic individuals contribute to studies as consultants or co-researchers, is growing and offers valuable insights that traditional research models have ignored. By centering autistic experiences, researchers can develop better diagnostic tools and treatment approaches that address the needs of both autistic men and women. Autism has never been a male-only condition, yet for too long, the world has treated it as such. As awareness grows and research expands to include autistic women and girls, there is hope for a future where no one is overlooked due to outdated stereotypes. Rapon's work serves as a reminder that science must be willing to challenge its own biases, because when it fails to do so, the cost is measured in years of misdiagnoses, misunderstood struggles, and unnecessary suffering.